Hello and welcome to Preconception Health Checks with the Healthy Conception Tool. Before we begin, I would like to acknowledge the traditional custodians of the different lands in which we all are today and pay my respects to elders past and present. My name is Joanna and I'm from Your Fertility, and I'm here today to talk with Dr. Edwina about preconception health checks and the Healthy Conception Tool for the first day of Women's Health Week. Your Fertility is a community partner of Jean Hales Women's Health Week 2022, and we will join Jean Hales in celebrating the campaign's 10th year. Women's Health Week is the biggest week in Australia dedicated to good health and wellbeing for women, girls, and gender diverse people, and supporting the people who care for them. Your Fertility recognises that not all people who need access to women's health services identify as women. Where we refer to women today, this includes all people with ovaries requiring reproductive health care. I'd now like to welcome our guest, Dr. Edwina Dorney, who is an expert in sexual, reproductive and public health. Edwina, can you please tell us a bit about yourself?
I can. Thanks, Joanna, for having me along today. I'm coming in from the land of the Camaragal people. So I am a doctor with a background in women's health, predominantly in obstetrics and gynaecology, and more recently re-specialising in public health medicine. I'm currently a medical advisor at the Centre for Population Health in New South Wales, and I'm also doing my PhD, and this is in the field of preconception care, working out ways how we can best help the population know how to become healthy for pregnancy. So I'm really lucky that both my work and my research combine my passions of reproductive, sexual and public health.
We're really grateful that you're sharing your expertise with us today. This Women's Health Week, it's all about you. The theme is a reminder to set aside time for your health and well-being, in particular, making sure that you make appointments to get health checks. Today, we'll be focusing on preconception health checks. We know that when trying for a baby, it's important to be as healthy as possible. Regardless of your gender, there are factors that can affect your chance of conceiving, as well as the health of a future pregnancy and child. Edwina, can you tell us about some of those factors?
Absolutely, Joanna. So these factors are things about us, our history, our lifestyle, or our behaviours that can impact on a pregnancy that we may have. Now, typically, we've always considered these factors as being things that carry a risk. So, for example, you smoke and therefore that's bad for you and your baby. But what we actually know about these factors are that these are things that we can control or modify. So they're actually things that can benefit us and our pregnancies. So instead of thinking, I've got a really bad diet, what we can do is think, well, I know about this now, so I'm going to change my diet, and that's going to give me a better pregnancy and better chances for my baby. Now, it was close to 20 years ago when preconception, or working on your health before pregnancy, really got momentum, and a panel in the US came up with over 80 of these factors that we could do or changes we could make before we fall pregnant. In order to make this into a meaningful message for us, these factors have been grouped into categories. So we've got biomedical, so medical things about us, our medical history or our previous pregnancy histories. We've then got our social, so this could be what's our environment like at work or at home? Are we exposed to any chemicals before pregnancy that we might need to modify or change? And then the third group is the behavioural factors. So these are things like smoking, alcohol and exercise. And all of these factors are things that we can learn about and change so we can be as healthy as possible before pregnancy and improve the chances for our babies and children.
I love the positive way that you've framed that. Rather than focusing on the negatives, it's about what can we do and what can we do moving forward to make sure we're as healthy as possible before pregnancy. As we've mentioned, we're focusing today on preconception health. Can you explain to us what a preconception health check is and what preconception health is exactly, and why are these health checks important?
Absolutely. So, Joanna, look, preconception is a word we use in the medical and clinical field all the time. And it wasn't until we started doing some research in here that we realised that most of the general population doesn't use this term. So preconception literally refers to the time before you become pregnant. Now, what's tricky about this is it can be really broad. It can be just those couple of weeks to days before you become pregnant, or it can even be years beforehand. The thing about a preconception health check is that you don't need to do it just before you're thinking about having a baby. You can do it at any time, so even a year or two beforehand. Now, to set the scene, about 1 in 10 of us will become pregnant each year, whether we're really planning to right now or not. So that in Australia, that roughly turns out to be about 340,000 pregnancies a year. What we do know is that of this enormous amount of pregnancies, less than half are planned. Now, that doesn't mean that they're not wanted. It just means that we weren't planning to get pregnant right now. So by the time most of us find out we're pregnant, it's too late to make sure we're in the best health we can be before a pregnancy. So if we work on our health before we become pregnant, that not only increases our chances of becoming pregnant, it gives us better pregnancy outcomes, and it gives better health for our children and their babies. We've now got this amazing science to show us how important it is to improve our health before pregnancy. We can't change the DNA that we've been given. So we can't change the DNA that's in our sperm or our egg that we're going to contribute to that pregnancy. But what we can do with our lifestyle behaviours and our medical behaviours is actually change what parts of our DNA we turn on or off. And this is known as the developmental origins of health and disease. So what we know is that if we eat a diet that's really rich in fatty foods, and if we smoke before pregnancy, that this can turn on or off different genes in our sperms or our eggs, and that goes down through to our babies and impacts on them being children. So if we eat a high-fat diet, that programs our babies to like that high-fat diet and make them more likely to become overweight or obese as children and have poorer health as their adult life. So this preconception check is all about teaching us about these things and helping us work on these factors together, so that we can have our best health before a pregnancy, for a pregnancy, and our children.
Why is it specifically important for women to get this type of health check?
So look, Joanna, this is a great question. It's important for both women and men. But given this is Women's Health Week, focusing on it for women, there's so much that we can do that we may not necessarily be aware of before a pregnancy. So some of the things that can happen in a preconception health checkup for us, it's all obviously about you and what we need to target for you. And it starts off just with a conversation, learning about your history. So for a woman, she may have had previous pregnancies before or trouble getting pregnant before, and that may lead us to a few things that we can modify there. It also helps us to learn about simple things like when's a good time to have sex, when's my most fertile window. For women, there are other things specific to us, such as making sure our cervical screening is up to date, that our breast check is up to date. Have we been tested for sexually transmitted infections? In women, quite often, STIs such as chlamydia and gonorrhea can be silent, and they can be really affecting our fertility. For women, there's even more. There's things such as our vaccinations. So vaccinations to rubella and chickenpox, having those up to date before we fall pregnant, so there's no risk to our baby. The other thing for women, and this one is also for men, simple things like if you're a diabetic, glucose or having our babies or our eggs in a high glucose environment is one of the most powerful, what we call teratogens. So glucose is actually a chemical that can harm our eggs and our babies as they're developing. So even just fine tuning your blood sugar, if you're a woman with diabetes, has a massive impact on the health of a pregnancy and for your children.
So if you're planning to have a baby, it's a good idea to make an appointment with a doctor to help you understand what areas you may need help with when it comes to improving your health to have a baby. What sort of tests might be done during this preconception health check?
So they were some of the tests that I just mentioned before, but Joanna, you really raised a great point there. You said, so if you're planning to have a baby, you should arrange a preconception health check. Absolutely. But even if you're not planning on having a baby. If your doctor, and you go to see your doctor or community health nurse for something unrelated, it's also about being open to the fact that if they happen to bring it up, even if you go in for a broken arm, if someone was to say to you, are you thinking of becoming pregnant in the next year, or how do you feel about having babies? It's about being open to the discussion and being ready to learn that there are things that you could do later down the track. And then this may lead into that discussion about the tests that you could have. So the STI checks, the blood tests to check your immunity levels for vaccinations, or it can just be that discussion to sow the seed, to think about what you can do for a pregnancy. And the other thing is that preconception healthcare is not just limited to your first pregnancy. It's something that's really important and relevant in between your pregnancies, in between a first and second pregnancy. We sometimes fall into the trap of thinking just because we've been pregnant before, we know what to do for next time. But there are things we could have learned from the pregnancy before that we can work on and change to give you an even better outcome for a second pregnancy.
At the start of this, we mentioned something that we haven't spoken about yet. So can you tell us about the Healthy Conception tool and how does it work?
Oh, absolutely. So the Healthy Conception tool is what we call a self-assessment tool, or essentially a little online quiz that's housed on the Your Fertility website. And it's there to be like a checklist or that first self-checker, so you can work out things or how healthy you are if you're planning to have a baby. What it does is it currently has 14 questions. So there's a different version of the quiz for people who identify as being female or male, or really what it's about is, are you contributing a sperm or an egg to the pregnancy? And it goes through sort of 14 areas of those factors of things that we need to be aware of that we could consider to improve our health before a pregnancy. So what it does is it asks you the question and then it gives you some information about that particular factor, of how you can consider that to improve your health before a pregnancy. It also has links to other information sources. And really what the tool is asking or calling you to do is to become aware, to have some new information and some new knowledge, and then to take it a step further and to go and see your healthcare provider to discuss this in more detail, to make it more about you and empower you to make those changes.
So that sounds really great, but how easy is it to use?
It's getting easier. So look, so it already was quite easy to use, but part of our research that we've been doing is taking this tool, and we've interviewed people around Australia from various different geographic locations to find out how easy they found the tool to use. And they've given us some tips to make it easier. So the current tool that's up there, if you were to jump on today, is the old version that's about to get modified. But it's easy in the sense that you can use it anywhere, anytime, on your mobile or on your desktop. It takes about 3 minutes to complete. So it's very quick and it's very private. There's no audio, there's no confronting images, so you don't even have to worry about where you are when you're going to use it. The other thing about how easy it is to use is you can download your results. So you will have that list there for you, of all those factors of things that you can do. So yes, it's very easy to use.
Quick, private, and takes 3 minutes. Sounds great.
Yeah.
Can you give us a bit more information about some of these great changes that are coming to the tool?
Absolutely. So what people told us, the first thing they said is, no one's going to find this online, as it's currently called Healthy Conception Tool. So the first thing the tool is going to have is a new name. Now, this is still to be revealed, but it's going to be something that's much more easy to find online and as simple as, are you ready, or getting ready for pregnancy. It's going to have a new, more user-friendly look, right down to the way you answer the questions. So it's just going to be a single click of the button. It's going to have more simple language to understand, right from the title. Sometimes we get a little bit carried away with the words that we use. So the questions are really easy to understand with information windows there for you. But the really exciting part is how, excuse me, how the results are going to be able to be used by you. The first thing is the results are going to be grouped together in 3 clear areas. Things you need to work on now, things you need to consider, and then the areas where you're doing really well and keep on track. Now, within that, it's going to have the answer you told us. So if we take the example of smoking, it'll be, you told us you currently smoke. It will then have the reason why it's important to know if you smoke or not, so the risks or benefits this carries to your baby. And then it's going to tell you what you can do. So it's going to link you to information to help you make positive behaviour changes. So it's going to tell you what, why, and how we can make these changes. The other things, the results are going to be in an easily downloadable format, or you could share them with your healthcare provider, and you can also share the tool with a friend. So these are some of the new changes we have.
So you've just quickly touched on you can download the results for your healthcare provider. How useful are these results in a preconception health check?
So they're incredibly useful. It can serve, we all know how busy our time can be when we see a healthcare provider. And one of the biggest barriers that our GPs and our primary healthcare nurses have raised to being able to provide preconception care is that there's often not enough time. So having this checklist there can not only serve as a catalyst, it can be the reason why a person comes in to see the GP, but it can also save time as flagging some of those key areas for us to work on in a very busy appointment.
When would be the best time to use the Healthy Conception tool, and who should use it?
So any time is the best time to use the Healthy Conception tool. And this is where it's all about you. If you're someone who doesn't mind when they have their pregnancy, if you're not time bound, juggling other family commitments or work commitments, then it's definitely use it now. For some people who are on contraception, who have other medical conditions where they need to get these into check before they can cease their contraception and think about having a baby, again, the time is now. It's just more important that you use it at some stage to increase that education. So we would say any person of reproductive age who has the potential to become pregnant should be using the Healthy Conception tool.
The more you know about your health, the better. While we're focusing on women today, it's important for men to be as healthy as possible before conception. We know that historically too much of the responsibility for health for pregnancy has fallen on women. Can you tell us about why this isn't just an issue for women?
Yep, that's such an important point. So men, or sperm, contribute 50% of the DNA of a pregnancy. So it's an equal weight of getting healthy before pregnancy across both partners. The thing about sperm is that they regenerate or regrow every 3 months. So that 3-month window for a man before a pregnancy is crucial so that they can make sure their sperm are in the best health with the best expression of that DNA that's in there. To increase chances of becoming pregnant, the health of the pregnancy and the health of the child. So all of those factors for men, the same as women. So smoking, alcohol, diet, weight, chemical exposures, they're all so important to know about so that they can be in the best health possible before a pregnancy.
What can people do to improve their health if they're trying to get pregnant? We've touched on a couple of factors, but what are the factors or the top 10 factors you can work on yourself to potentially improve your fertility?
So again, this is modified to the individual. Just as Women's Health Week, it is all about you. But we've had a recent panel of experts in Australia come together to set the priorities for the Australian population of what are potentially the top 10 areas for us to improve on before pregnancy. Now, this does relate to a person's medical history and their prior pregnancy history. So it's the simple things. If someone is above a healthy weight, it's working out ways to bring the weight down into a more healthy level. So looking at diet and exercise. In that diet factor, it's not only healthy eating, but making sure the nutrition supplementation is in there too. So what that really means before a pregnancy is making sure your diet is rich in folic acid and iodine, as these are critical to how a baby develops. If there's trouble having that in your diet, it's as simple as grabbing a supplement from the chemist of folic acid and iodine. The next things with your medical history, as I mentioned, if you have a history of diabetes, it's getting good control of those blood sugar levels. That's of critical importance to a growing baby. And also, if you have a medical condition where you're taking a tablet, the simple question of, is this tablet safe for having a baby, or will it pass through to my baby? And looking for an alternative. There are the behavioural factors such as smoking and alcohol, and working to really cut down those before having a pregnancy. There's other things such as your family history or genetic history. We now have much more advanced and easy to access tests to work out if there is a risk of a genetic condition for your baby. Other things such as we mentioned before, sexually transmitted infection and screening behaviours, so breast screening and cervical screening. And of course, there's vaccinations in there as well. So things such as we mentioned the measles vaccine and the chickenpox vaccine as well. It's also about knowing your environmental exposures. So what that means is chemicals in the workplace or the home that for men can impact their sperm, or for women that can impact a growing baby. And then, of course, there are some more social things. So we need to look at the risk of intimate partner violence and making sure that both potential partners have a safe and secure home. And then, of course, mental health is the next big one for us, making sure that we have everyone in a safe and secure place before having a pregnancy. Now, as I mentioned, there was over 80 factors identified by the panel in the US, and these factors, it's still growing, but they're the really relevant ones for us here in Australia.
Thanks for that, Edwina. We've covered a lot of information today, so I only have one more question for you before we finish up. If you can leave people with one key message, what are the key things you want women to remember when it comes to thinking about their health prior to having a baby, and what actionable steps can they take to boost their fertility?
It's really tricky, Joanna, to get it down into one, but the thing is to be aware. We talk about having a reproductive life plan. Now, while we can't always control everything, for a woman or a man or any potential parent to have at the forefront of their mind to think about, am I open, or do I want to at any stage possibly have a pregnancy, and to factor that in when that might be and how far apart possible pregnancies might be. As long as you take that message away, then all the other factors will come into play. To think about, where am I going to tie things into my reproductive plan? What do I need to do? And you can start with something as simple as the Healthy Conception tool to help you materialize that plan or bring it into being. So yes, have a plan. And if we can't do that, then the message would be just to think that it can be you. The most common story I certainly see is potential parents coming in saying, I knew I maybe wanted to have kids, but I didn't think it'd happen this early. And now I'm unprepared. So yes, so plan if you can. If you can't plan, be aware. And of course, we all try to keep ourselves in the best health we possibly can at all stages.
Be aware is a great takeaway message. It ties right into Women's Health Week. It's all about you. That wraps up all of our questions for today. Thank you for your time, Edwina. Preconception health is such an important topic, and if you're looking for more information on this, you can always visit yourfertility.org.au for more information. If you were thinking about trying to have a baby, you can check out the Healthy Conception tool. You can find it in the general resources section of the Your Fertility website. We'll be posting more about the tool, especially when it gets its new name, and preconception health checks throughout the rest of Women's Health Week. So make sure you're following us on our social media to see that. You can also head to womenshealthweek.com.au to find out more about Women's Health Week 2022. Thanks for joining us and have a lovely day and a great Women's Health Week.